Most of the work has been done now, but there are some simple things you should do to get the most out of your dry cow therapy. Make sure cows walk quietly out of the shed to the paddock. This relates back to the number of cows you dry off in one go. Avoid prolonged yarding or lying on the ground or transport in the early dry period. When the quarters fill up with milk, having the cows boxed up may encourage leakage, which will be more problematic if the cows spend a lot of time lying on contaminated surfaces. Observe cows daily for the first 14 days of the dry period, looking for signs of clinical mastitis. Do not bring cows back through the shed to check them because that will encourage them to let their milk down. Consult your veterinarian if clinical mastitis occurs. Teat seal reduces the incidence of clinical mastitis over the dry period and at calving, but it does not necessarily prevent it altogether. Mastitis will still occur if the challenge is high, so you should still take steps to minimise environmental mastitis challenge. It is generally recommended to milk heifers and cows prior to calving if they are dripping milk. Dripping of milk can still happen even when internal teat sealants are used, although it will happen to a lesser extent. As soon as animals drip milk, the teats are open to the environment and at risk of mastitis. Heifers that develop udder edema are particularly prone to mastitis because the teats swell up and no longer close properly. Avoid excessive walking and lying for cows that are tightly bagged up before calving, as it may dislodge the teat seal plug. Animals with internal teat sealants on board are treated a little different at the first milking. Be sure to manually strip each quarter at least 10 times to remove the plug. You will usually see a long coil of teat seal come out. If after 5 strips it stops, keep going because there is usually more. It is normal for some quarters to have less teat seal present due to calf suckling. Research has shown that teat seal does not prevent calves from suckling and getting colostrum from their mothers. All dry cow therapies, including teat seal, have an 8 milking withholding period after calving. Do not shortcut this withholding period. All cows, regardless of dry cow therapy, should be withheld from supply for the first 8 milkings. Finally, make sure you can tell the difference between flecks of internal teat sealant and clinical mastitis. Internal teat sealant is typically waxy, brilliant white colour and does not dissolve when rolled between your fingers, unlike mastitis clots. For more information, visit our Dairy Wellness website or talk to your vet.